Hello, my name is Dr. Sanjay Kumar. I am an associate professor in psychology at Oxford Brookes University in Oxford. Uh, in this talk, I'm going to discuss about our recent publication in Global Psychiatry Archives, which is on inhibitory rTMS to the right temporoparietal junction, which in this paper we discuss about how it can be used to improve depersonalization and derealization. This paper was written with my collaborator, Dr. Tina Malhotra, and it was co-produced by the patient. This is a case report where we will be discussing about a particular patient's and experience and the treatment approach that we took. If we think of depersonalization and derealization disorder, which we can call as DDD, which is a very common psychiatric condition characterized by a feeling of unreality from their surroundings, being an outside observer of their own thoughts, different kind of bodily sensations, or some experiences of unreality. The prevalence is around 1% in general population, and in psychiatric outpatient, it rises to 5 to 20%. And if you think of inpatient psychiatric population, then it can go up to around 42%. There are different treatment approaches for this particular condition. It can be treated with pharmacotherapy or cognitive behavior therapies. In, Here, we will be looking into one particular case where we use rTMS, repetitive transcranial magnetic stimulation, to treat this patient. Uh, we used rTMS to the right temporoparietal junction, and the primary reason for using right temporoparietal junction was the symptom profile of the patient, which we will discuss a little further on as well. But the characteristic of the TPJ, if you think of, it is a polysensory cortical area which has active role in perception and awareness, uh, and it lies on the borders of temporal and parietal lobes. It it is also involved in not only multisensory integration, but also in social cognition or self sense of agency or a stimulus-driven attentional function. The case is of a 27-year-old female who was also diagnosed with generalized anxiety disorder with DDD symptoms. And if we look at her presentation, the patient's presentation, the patient currently she is 27 years of age, but at 23 years of age, she had a single usage of magic mushroom, and she experienced panic attacks and acute episode of derealization, which subsided within 2 weeks. But around 2 years ago, after a severe stressful event, there was a severe relapse of these symptoms. Uh, and the symptoms were uh, distorted vision, over processing at the local level, looking at the details in a much more finer way. We have given some examples, such as if the patient would look at the tree, the focus would be on the individual branches and the leaves rather than the whole tree. Uh, or in the supermarket shelves, for example, the individual items that she would focus on. Or she would drive to different places and would see a scaffolding to fix any building, and there she would notice the individual poles and connecting joints rather than the whole scaffolding that is surrounding the building. She also had a kind of dark filter that she was used to report in her vision. She had visual floaters and grid line uh, in the visual field. She also had increased color intensity perception and derealization symptoms as well. Uh, Patient did not complain of problems with attention and concentration, and no other psychotic symptoms or ophthalmologic causes were identified. So those were ruled out. Uh, I'm not going to go into much detail into what the patient was having the treatment before coming to us for the rTMS. The primary reason the patient came to us for rTMS after having an extensive uh, research herself that possibly rTMS could be useful. And here, she had not been responding to prior treatment. Uh, in this case, we used 1 Hertz, which is an inhibitory protocol over right temporoparietal junction, uh, over 15 sessions, and each session was one single train of 1800 pulses, once a day for 5 days a week, and patient did not have any side effects. We had some questionnaires to track the symptoms. Uh, Particularly, our focus was to look into experiences on Cambridge depersonalization scale. Uh, I'm going to just show you what scores were. These are on Cambridge depersonalization score. Frequency and duration seems to be quite high, and in different domains, again, it was quite high. Uh, There not much of anxiety when she presented to us, but she had a diagnosis of generalized anxiety disorder, which was controlled by the therapeutic intervention that she was receiving. But she had high depressive symptoms, mostly related to uh, what she was going through, those experiences. In order to understand her particular symptom of over-focused on local elements, we did a known kind of local and global processing task. And in local uh, uh, level of target, reaction time was slower compared. The local level target reaction time was faster compared to the global target, which mimics what she was reporting as a symptom. Uh, After 15 rTMS sessions over 3 weeks, we observed quite good improvement, around 44% of improvement on TDD symptoms on the Cambridge realization scale. There were remarkable changes on many of the symptoms that she had reported. She also reported improvement on some cognitive symptoms. Uh, what we also noticed that there was an incremental improvement from 10th session to 15th session, which suggests that the dose response pattern, the more number of sessions, the better the response are. Uh, So, one thing probably I shall highlight here that those improvement were in the duration of emotional numbing. There was some improvement on deep personalization related symptoms. Uh, Here, the discussion point for us is that why did we use uh, right TPJ as a target? In the literature, two primary targets have been used. One is the ventrolateral prefrontal cortex, and the other is the right temporoparietal junction. Uh, because of the temporoparietal junction's proximity to several sensory areas, and many of her symptoms were primarily of sensory nature, more so in the visual domain. We thought that RTPJ would be an ideal target. Previous findings has also indicated that RTPJ is overactive in these patients, and therefore an inhibitory protocol was considered. Uh, there are some previous reports as well that, although again small or case studies, that rTMS has been effective in treating symptoms of DDD. Uh, there was an earlier study which also showed that around 44% of reduction in DDD symptoms, very much similar to what we found after 3 weeks of treatment. Uh, Interestingly, uh, her performance on Navon kind of task where pre-treatment she had a faster reaction time to local elements, which is slightly contrary to typical findings in cognitive neuroscience, that there would be typically faster reaction time to the global targets. After our TMS intervention, uh, it changed. So it started mimicking the commonly observed pattern of faster reaction time to global elements rather than the local elements. Uh, Although she did not report much improvement at the symptom level on the local and global processing. It might be that additional target needs to be engaged. If we look at Carmel Mevorak and Glenn Humphrey's work, we know that uh, intraparietal sulcus, it contributes differently to the local and global salience processing. Uh, Ideally, in a research setting, probably that could be tried as well. Here, with this uh, case report, we have indicated that rTMS could be an effective treatment for DDD. And it is very specific as the patient did not show improvement on depression symptoms or anxiety symptoms. So the targeting of RTPJ seems to be quite specific to the symptoms experienced by the patient. Uh, it is possible that there could have been more improvement following a longer treatment duration, as we saw that there was a gradual progression of improvement from the 10th session to the 15th session. So overall, we suggest that there is a good possibility that such kind of uh, novel intervention can be useful in unexplored clinical conditions by RTMS or the neuromodulatory intervention. Hope that was useful to you all.